The Biden administration has moved to enter the United States into a binding agreement with the World Health Organization that would cede authority to the WHO to dictate worldwide policies during any future declared pandemics. Now, how can the Biden administration do this when, according to the U.S. Constitution, the U.S. Senate approval is required for international treaties? I mean, two-thirds approval by the Senate. That's not going to happen. And why is the administration pushing to give the WHO this power? It's a global bureaucracy. Well, joining me now to discuss this is Michele Bachmann. She served in Congress for 8 years and is now the dean of the Robertson School of Government at Regent University. During her time in Congress, she served on the House Permanent Select Committee on Intelligence. Dean Bachmann, all right, we're having trouble connecting her. We're going to get her here on the phone. Look, we talked about this last year as we were tracking it, and then it's been progressing. They've been working on this. So next week, they actually have this treaty, and all of the nations that are a part of this, 190 some nations, will be meeting to push forward with adopting this treaty. Now, the way they've got it set up, it's structured so that it's binding even though it might be pending in a nation for approval. And it's not going to get approved in the United States, but it's structured in such a way, as we've seen, the devious left and the bureaucracy that drives this global behemoth is designed to ensnare other countries. And so this would essentially be giving the WHO the power to control policy worldwide during a pandemic, not just for, say, telling the federal government, but even binding the states. All 50 states would be bound by this agreement that they're working on, this treaty. They are scheduled to meet February the 27th, all 194 WHO member states. Now, again, the question is, why is the Biden administration pursuing this? Well, I give you my thoughts on it, is that this is the way the left has long worked in this country. They use international policy to come back and bind the United States. We see this at the State Department. That's why the State Department is one of the most liberal entities pushing some of the most egregious policies globally. It goes to, this is how it works. They push it out into these other countries. It goes into the United Nations and then comes back on us. Joining us now by phone is Dean Bachmann to discuss this. Michele, welcome back to Washington Watch.
Tony, thank you so much, and thank you for covering this important story. This is about as big as it gets, Tony. There's never been a bigger power grab than this power grab, and it's being led by the Biden administration. It's counterintuitive because normally a nation doesn't want to give away its power, but the whole purpose of this legislation would be that 194 countries, all of the member states of the UN, would give up their sovereignty to the World Health Organization over healthcare. So in the case of a pandemic, the World Health Organization would be empowered to declare a medical emergency, and they would be empowered to manage that medical emergency. So what this means, Tony, is that our politicians in the United States would have no power. We would lose our voice as a people. Attorney generals would lose their voice. Our Supreme Court, federal courts, state courts would lose authority. Even your local doctor that you go to would lose authority because the executive director of the World Health Organization would be empowered to make decisions over vaccines, masks, lockdowns, supply chains. Almost every aspect of our lives would come under the authority of the World Health Organization. That's never happened before. When we saw churches being closed because the CDC was making recommendations at the US federal level, we pushed back, and states were trying to push back. Now there'd be no difference. There couldn't be a Florida or a Texas or a red state that could opt for freedom. The World Health Organization would have this power, and they would have the power to monitor all of our states and surveil us. And this also creates digital passports for our healthcare, and we would lose our power over our healthcare decisions.
This is not just them declaring a pandemic. As you said, this is the practical implication of what you do when there is a pandemic. Not only can they declare it, but then they can dictate even what medicine your doctor prescribes for you in this pandemic. They can say you cannot give ivermectin. You have to give this drug. So, I mean, this is far reaching. I don't think there's any precedent of this level.
There is no precedent, because the bottom line impact of what this means is this would create a platform for global governance. That's never happened before. The UN has wanted that for years. A number of organizations like the World Economic Forum are advocating a form of global government. This would actually, Tony, create global governance. And the Biden administration is leading the charge. They're trying to do it through what we call a global pandemic treaty, but they call an accord. They're trying to bypass the US Senate, but they're also trying to do it by changing the rules at the World Health Organization in Geneva, Switzerland. They're going down two tracks because they're determined to reach their goal, which is giving away US sovereignty. And so in effect, what this would do, Tony, is create a medical police state, not just for the United States, but for all countries of the world. Because what the UN wants is the right to dictate that every country on earth has to do the same thing. Sweden,
Michele,
for instance.
we're up against a break. We're up against a break. Sorry we didn't get connected in time. But what's the action item? What should people be doing?
People need to melt the phone lines of U.S. senators and tell them that they need to demand that this treaty comes into the Senate for a hearing. And Kevin McCarthy also needs to hold hearings.